What's up, everybody? Welcome back. Sorry, I am about 20 minutes behind today for this live recording. So today I wanted to hop on very quickly and answer any questions that people may have with regard to their back pain. So this is more of like a ask me anything, ask me any questions that you may have. I will definitely wait for a little bit for some people to come on. And if you don't have any questions, that's fine. We will kind of reconvene because let me get my speaker a little closer. Okay. So I guess I'll just talk a little bit on x-rays and MRIs and when should you get an MRI, when should you get an x-ray and things like that. Because I think a lot of people, the first question or first thing they do is they ask, should I get an MRI? Should I get an x-ray? Should I get some sort of imaging? And imaging is great. Like, if you think about what imaging really is, it's just a blueprint of what your body looks like or what your spine looks like. And it's not a definitive answer to who you are, because the reason why imaging can be detrimental is because it doesn't always tell you how you function as a human or how you function as a whole. Essentially, like I said, it's a blueprint of who you are. It doesn't tell you how you move, how you don't move. And research-wise, guys, this is probably one of the most important things, is research-wise, we cannot predict. We cannot predict arthritis. We cannot predict if arthritis or degenerative joint disease, which is another topic for another day, causes pain. And a lot of people are like, well, my doctor said that my arthritis is the reason why. Like, yeah, you might have arthritis, you might have problems, you might have low back issues, but you may not actually have the pain. And there's plenty of people out there, about 98% of people walking this earth right now have some sort of arthritis, they have some sort of joint disorder, but yet they may not have pain. And then likewise, there are some people out there who have pain and have a perfectly normal looking spine. And so you can't always correlate MRIs and x-rays with pain, despite your doctor going over that stuff with you. So I'm going to be here to tell you right now that you should not, more than likely, not all the time, there are certain red flags and things that you need to rule out. People who have progressive neurologic changes, people who have been unresponsive to care. Notice I said unresponsive to care. That means you actually have to try care, and try to do it for an extended period of time before you get an image, before you even think about that. Like, you should not jump to an image unless you've had some sort of trauma, you've had some sort of red flag. And those red flags, like I said, are trauma, maybe infection, and your doctor should be ruling these things out. Bowel, bladder loss, progressive neurologic changes, unresponsive to medical care, unresponsive to conservative care. These are things that may warrant or need you to get an x-ray or an MRI. So the problem is that we as humans just want a quick fix, and we want an answer to why our back pain is having the pain that it's having. And because it's having the pain that we have, we want this structural answer, this very biomechanical answer that says, hey, here's your problem, here's how we fix it. But here's the truth. Most doctors will say, here's your problem, here's your arthritis, which may or may not be right. Here's your problem, and here's how we fix it. Oh, by the way, you can't do anything for arthritis, which let's not talk about that right now. So what people will say is that your arthritis is causing your back pain or this or that. But that's so, like I said before, it's just not real. It's not accurate, and research can't predict that, and you can't predict that either. So the most important thing I would ask you to ask yourself is, how do you feel, right? Are you in pain? Are you tight? Do you have a problem? Are things not feeling right? And how do you function? Can you do the activities that you love to do? Is there a limitation on what you have? Can you not do can you not bend down and touch your toes? Can you not pick up your granddaughter? Can you not pick up your grandchild? Can you not walk an extra mile that you want to accomplish? Does it require training to do this stuff? Because you can't compare your old self to your current self. It may take you some time to get back into it, but just because you don't function well or do function well doesn't mean you have an injury or something like that, or vice versa. So really, it's more about how much pain are you in and how do you function. If you have pain and you don't function well and all these other things are problematic and you've tried care, then maybe you should try an MRI or an X-ray. But too many people jump right to the X-ray and the MRI and don't have an answer. When, to be honest, I almost never recommend an X-ray or an MRI in my office without trial of care. Meaning you need to try some care. You need to try and give yourself 100% effort to actually try to resolve that condition. And you need to give yourself the honest effort, not just the effort, but the honest effort that you can actually do this and complete this. Because if you have an MRI, if you have an X-ray, it doesn't really tell you how you're functioning and how your pain levels are. So I guess that's really kind of that in a nutshell. And I wanted to touch on it because every single person says, oh, I wanted to confirm my MRI or my back or my herniated disc. I wanted to confirm it. I'm like, you know, a good doctor, a good professional, a good therapist is going to tell you what it is likely prior to, and you don't really need the MRI. Now, you'll only need the MRI. The MRI is really designed to catch anything else that we don't suspect, or if that person's progressing in a negative way. So that's it, guys. Like, it's that simple when it comes to an MRI and an X-ray. And it is very, very cost effective, not cost effective, you know, to our system. Hey, Lourdes, welcome. It's not very cost effective to you because sometimes if you have a deductible or something like that, you're going to pay anywhere between $300 and $3,000 for an MRI. You're going to spend $150, $200 on an X-ray. You're going to spend, if you have an HMO or in-network or whatever you want to call it, you're going to spend hundreds of dollars prior to doing any of this stuff. So think about that, guys. Like, when you have an X-ray or an MRI, you're going to spend out of pocket. You might as well spend out of pocket anyway and get some care. Get real good care. Fix your back the first time. I almost never get an MRI or an X-ray unless it's warranted, and almost every single patient I see gets better. So you don't need it, and it's overly diagnosed, and it's just to help validate the doctor and validate yourself. However, that being said, research-wise, people tend to really like this stuff and really contribute to a good quality program when they have the confirmation that their back or their disc is herniated or something like that. So there is no problem for getting an MRI or an X-ray. But I would urge you guys, if you do have pain, if you do have dysfunction, if you're not feeling your optimal, go get some therapy first. Go give yourself the honest effort before you spend your energy and your time and have all these people read you these giant words on an X-ray and MRI that you just don't understand, because that can be scary in itself. Now, they do provide value. I'm not going to say that I don't MRI or X-ray people ever, or that I haven't recently referred out to that. But if you're not getting better, then that's a different story. If you haven't tried, guys, go try. Put yourself in the best optimal state to get your back and your body healthy. And if it doesn't work, then ask questions. But don't ask questions that you haven't even tried to answer, you know? So try to answer these questions with yourself, with another therapist, with anybody else before you start jumping to MRIs and X-rays. They can be cost effective. They can also be very valuable. But guys, overall, you know, they are a good tool, but a good clinician can be your best tool. So that's it for today. Anybody has any questions, stay on a couple more seconds. I know it's a light crowd day, but feel free to ask questions in the group, guys. Always, if you have questions, comment, tag me, post. I'm not always there, but that's why you have a tab or a post, so that if I don't see it, if I'm not live or if I'm not there, you can always ask me that question in the future. So I will see you guys soon. Thanks again, and I hope that this was a little bit more insightful about MRIs, x-rays, imaging, and your back pain. So see you guys next week, and if you have questions, let me know. Bye.